Good afternoon. Welcome to the fourth Wellness Summit session. Corona-Phobia, virus anxieties, and getting help. My name is Gloria Fine. I am your moderator for this session. I'm thrilled to be here. Last year was my first year as a volunteer on the Wellness Summit Committee. This year I've graduated to being a Jewish Family Services board member on the committee. I care deeply about our community, which includes community mental health. I'm excited that we have been able to go virtual and open the summit to an even broader community, including people who are joining us from downstate Delaware and outside of Delaware. Please feel free to ask questions during this session. Click on the Q&A icon at the bottom of your screen during the session. I will ask David and Paul your questions as they are ready to answer them. If we cannot get to all of the questions, we will be posting answers after the session. Today, we are joined by the father-son team, Dr. David Sheslow and Paul Sheslow. David joins us from the Hockessin Center for Change, where he specializes in anxiety and family conflict. Prior to this, he worked at AI DuPont Hospital for more than 30 years, serving as staff psychologist, co-director of the Division of Behavioral Health, and director of the residency program. He holds an MA and a PhD from the University of North Carolina, Greensboro. Paul is a psychiatric nurse practitioner at Jewish Family Services of Delaware, where he provides outpatient medication management and psychoeducational services to clients ages 5 and up. He is an outstanding diagnostician and works collaboratively with his clients to develop trusting therapeutic relationships. He earned his master's degree in nursing from the University of Delaware. Please welcome David and Paul Sheslow.
Thank you so much,
Gloria. Let's see, screen share.
So the goals of today's time that we have with you is to talk a little bit about the effects of the COVID-19 virus on our lives from a psychological perspective, a biological perspective, and even a pharmacological perspective. If I had to think about one word that probably I hear more than any about what's happening during our times, it probably would be stress. So stress can be helpful and not so helpful. When we think about stress, we think about it as an inverted U-shaped curve, where if you don't have any stress at all, you're probably sitting by a pool, sipping by a pina colada, and you're not really doing anything productive. As your stress levels go up, it reaches a peak at the top of the U where you're most productive, most interested in doing a good job. And you're feeling that this is the place where I'm really getting things done. As that stress level falls over the other side of the U, productivity begins to suffer, and ultimately the stress level begins to fold in on your productivity.
Yeah, and we know that stress can cause a lot of mental health problems. It can also cause a lot of physical problems. You can see the list here that we thought were kind of the most pertinent to share. And I think the big takeaway right now is that everybody just seems so stressed out with COVID and the social distancing and things like that, that it's almost like a given now. Like, are you stressed out? Like, of course, you know. And I think in my own practice, the two questions that nobody wants to answer is what's new and are you stressed out? Because the answer is always yes. And I was seeing a kid who I said, "What's new?" And he said, "You're not asking people that question, are you? Because the answer is nothing." And I was like, "Oh, huh." And he was a pretty smart kid. So, I think, the main topic of this summit and kind of what we want to also hammer home is what can you do about this?
So before we talk about other kinds of mental health interventions, I thought it would be good just to talk about increasing our awareness, to reflect about what's happening with us during this time, and to spend some time honestly evaluating our inner lives. So if you're thinking about relationships, what were relationships like before the time of the virus? Were they fractured? Were they good? Did they suffer any change in a direction that you really didn't want them to go during the virus? Are you preparing for a time when the virus is no longer going to be there with us, so that you'll have something worth taking with you from this difficult time? But look at your values. Excuse me. Tune out the background for a second and turn off the media and just think about what's important. What was important before? How has it changed? What do you want to do about it? Your social life. Excuse me. um, your social life. Are there people that you've been thinking about but haven't connected with? Are there people who you've connected with but things haven't gone as well as you want? Are you thinking about your work life where excuse me, where we seem to be productive working in boxes, but we've lost some of the imagination in work, and we've lost some of the ability to connect and bounce off each other to be able to start new projects. COVID has had a way of turning issues that were subclinical into symptoms, problems, and even crises.
And along those same lines, what we're seeing are increased rates of depression, anxiety, PTSD, suicidality, especially in adolescents and teens. A lot of secondhand trauma from first-line responders and healthcare workers and caregivers. And from a medication perspective, interestingly, and probably not surprisingly, we're seeing increases in prescription rates for all of these things. 18% more antidepressants since COVID. Anti-anxiety medicines have gone up 34%, and 14% more insomnia medicines. So we know that in a very short period of time, a lot of these things are worsening. But on the other side of it, that also indicates that more people are seeking treatment, which is a good thing. The other aspect that I'm seeing a lot when I work with children and families and some adults is that now that everybody is home, COVID has actually sort of weirdly brought families together, kind of forced people more to spend time with each other, which has made some relationships more difficult, but a lot of the time it's actually helped in relationships and family dynamics, just with more time together. And parents, for better or for worse, are much more involved with their child's education and learning, and have kind of become second teachers, which I'm sure for a lot of parents is a lot. And since the start of COVID, we've also seen a huge explosion in telehealth healthcare for, out of necessity. But now that all these things are put in place and people are learning how to do healthcare remotely, especially with mental health treatment, it's allowing more and more people to get access to care, which is actually a pretty good thing.
So the title of the talk was Corona-Phobia, and in this country, it seems to be becoming a catch-all term for the behavioral and health issues stemming from the epidemic. But in the UK, there's some research that I found that was pretty interesting that are looking at a specific set of symptoms which turn into an attempt to identify a syndrome called Corona-Phobia. And the physical symptoms are dizziness, sleep disturbance, immobility, difficulty in organizing yourself for any kind of action. And of course, there's always stomach distress. Those physical symptoms seem to be highly correlated with these psychological symptoms: obsessive fears, constant worry that something might be going wrong, or someone you know might be sick, avoiding anything that might involve any kind of risk. And I don't want you to look at my pantry because hoarding may be a real thing. And of course, those symptoms lead naturally to the wave of anxiety and depression. I had my physical with my family doc this week, and he said, you can't understand how much anxiety and depression I'm seeing. And I said to him, Dave, I do this most of my life. Anyhow, so anxiety and depression is just become part of the epidemic of the pandemic. Feelings of vulnerability, feelings of impending doom, and in fact, the third wave that's affecting the country now seems to result in negative view of the world and negative view about the future, that we're going to be in lockdown forever, which is not true, but it is with us for a while to come, I'm afraid.
And along with anxiety and depression, we're also seeing a lot of increased substance use. I know one of my friends works at a liquor store and said he's never been so busy. People are home and there's not as much to do. And actually we found some numbers for you. Alcohol consumption has gone up by 14%. And a lot of recreational drug use has also gone up. Which along with that, really importantly, 18% more suspected drug overdoses since the start of COVID. So I think there are multiple things that we need to be paying attention to, and trying to get our loved ones and friends to seek treatment.
It was just, I thought you were going to ring the bell.
There has also been a lot of my patients have told me that some of the virtual AA meetings and group therapies, and it just doesn't really work for them. It doesn't feel the same. So there's kind of a little curve there of getting used to how things are right now.
I wanted to just make a special mention about loneliness. There's an epidemic of loneliness in our country. And in fact, the last time I had a chance to speak with you all, we talked about there's a minister of loneliness in the United Kingdom because of the pandemic of loneliness. That was there before the virus, and the virus has only made things worse. In a survey performed by Cigna of about 20,000 participants, almost half have reported sometimes or always feeling alone, and almost half reported having few meaningful relationships.
And it's interesting because I know that I see people 5 years old and up, and my dad, Dr. Sheslow, sees kind of the same kids and adults. And apart from reading the statistics, I think we're also seeing this in practice as well. And it's really, I find it really interesting because the people that are the most lonely are the 18 to 22-year-olds. Many of them have just finished college or are in college or finished high school and are trying to figure out what to do now. But it's interesting because they're at the lowest risk of getting COVID and dying from COVID and getting sick, yet they're a lot of the time having the most problem. Conversely, we're actually seeing that the people that are over 72 years old that are at the highest risk for this are the least lonely, the most equipped to handle this. It doesn't seem to be as affecting them as much as younger folks, which we thought was a pretty important thing to note and kind of interesting.
I wanted to spend some time. In doing research, I found some of these effects of COVID, which has permeated all aspects of our life, are not terribly frequently talked about, and I wanted to share some of that with you. Cracked teeth. If you've been to the dentist and you ask, they will tell you that they are seeing so many individuals with cracked teeth. In fact, when I was telling my sister about this, she told me she just got back from the dentist with fixing a cracked tooth. Headaches from temporal mandibular joint dysfunction, from TMJ, very common. Teeth grinding is very common. When studies that looked at dreams from pre-COVID to our COVID times have found more sadness and anxiety in the content of dreams of women, and considerably more anger in dreams with men. And women seem to be dreaming more than ever before, and not in the best possible way. It seems to be somewhat scary. LGBTQ youth seem to be having a particularly difficult time. The Trevor Project, some of you might know about them, did a survey with 1,200 LGBTQ youth and found about 3/4 of those individuals reported feeling increased loneliness, with over 50% reporting symptoms of depression. The data that I found most distressing was that 33% of youngsters reported not being able to feel like themselves at home. And a lot of that has to do with parental acceptance. And the last thing I'll share with you is 71% of LGBTQ youth reported a deep distrust of police. That's really distressing. Here's something that's really interesting. It's the opposite of what I would have thought. A study by the Brookings Institution reported about 500,000 fewer babies are expected to be born, a 13% drop in a survey of looking at potential parents. And maybe that makes sense when you look at one LA hospital reported that 8 out of 193 babies that were born in this inner city hospital were COVID positive. Potential parents seem to read that and think, yeah, maybe I'll put it off. It certainly makes the impact of us old folks will be greater because there'll be few young folks coming to replace us. Paul, is that you or me?
That's you.
That's me? Oh, and looking at a parenting study.
As a parent.
As a parent,
Yes.
I know this to be true because I'm still parenting. 40% of the respondents showed increased frustrations with their partner. And because they're living together, for better or worse and for lunch, and issues of childcare, issues of home chores. Guess who's doing more of the chores at home? Yes, that's exactly right. You all got it. And the difficulty in communicating, because two people are often working at home if you're lucky enough to be working. And So that being able to talk about those things has not been going that well because I have to rush off to the office here, which is in the next room. And again, not unexpected, 4 times more women than men have dropped out of the labor force. Over 850,000 people have dropped out of the labor force, and most of those are women. And why? Increased need for childcare, the increased cost of childcare, virtual pressures to keep kids being productive so that Google is not doing their homework. And of course, we would be remiss if we didn't emphasize that Black and Latinx job and income loss has become part of the increased level of stress in this country. And if political stress is not a real thing, you don't have a television. And if diversity issues are not a real thing, you don't have a TV. And if the virus isn't getting you, those other issues are contributing. This is the last bummer that I wanted to talk about because it's difficult, but I'd be remiss if I didn't talk about this. Intimate partner violence has gone up significantly. There's been a 5-fold increase of severe intimate partner violence injuries and a 4-fold increase in very severe. Very severe has to do with organ damage and worse. And there's a phone number for the National Domestic Abuse Hotline because calling is critical. Women in particular, about 10% are men, but women in particular, if they call the police, if they take care of the acute part of the intimate partner violence, you have a better chance of surviving and making it through. And yet, in a study from Brigham and Women's Hospital, which is a wonderful hospital in the Boston area, women have had fewer hospital visits for intimate partner violence than before the virus, because there's no way to get any privacy and there's nowhere to go. It's very difficult to figure out where you're going to go if you wanted to leave. So it's been a very difficult situation, and often alcohol is involved, of course, with all of this, which makes it even more difficult, of course.
And so I think a question that we both get all the time is, what do you do? What can make this better? And there's a number of simple things that you can do. Encourage friends to stay in touch. Take out the phone and call somebody. I think a lot of people are so used to seeing each other that we're a little bit out of practice with calling and not just texting. Promote integration between family members too, especially with the holidays coming up. And, a lot of people I'm talking to are pretty sad that they can't get together with their families for Thanksgiving or for Christmas, or they're getting together in small groups instead of the whole family. So I think finding ways to connect, and with Zoom and with other platforms, it's easier than ever, which is really nice. You just got to actually do it. Something else that I think obviously really helps is actually seeking help, which we're going to talk more about. And with telehealth, obviously some people have a little bit of a hard time with it, and getting used to it. But it's also really in some ways easier. I had a patient say, I feel like I have an on-demand mental health provider. I just open up my phone or my computer and you're there. So it's kind of great. And Medicare will pay for it. A number of the private insurers are waiving copays. So without a trip to the office, it's a little bit easier for some people to actually seek care. Something else I have been really hammering home with people is to get out and take walks, which as we're headed into the winter is a little bit harder, but on a day like today, it's a nice temperature to take a walk, get some vitamin D and some sun, and just appreciate what's around you. Along with that appreciation, comes mindfulness practices, which we're obviously can't get into the whole thing now, but the overarching theme of mindfulness is to just stay present, stay in the moment. Try and view the world like a little kid does. I always tell people, think of the first time, your kid or you as a kid saw snow, and think about how cool that was and awesome. And be present in that moment. It's raining, think about the rain. We can talk more about that if people have questions as well about mindfulness.
I actually put a couple of references at the end for places to connect
Awesome.
for mindfulness practice.
And there are a ton of awesome YouTube videos with guided meditations and mindfulness practices. I can certainly point you in the right direction. The last thing would be music. I think now that people are home more, listen to some more music. It can be so helpful, bring people together. I know a lot of bands are doing virtual streams of their shows and concerts, and that's been a pretty cool thing to be able to still at least a little bit go to a concert. I know a lot of people are really missing live music. So go to the show from your couch, and I think that goes along with just appreciating things.
So one of the before we move on to the next one, one of the symptoms of Corona-Phobia is immobility, and one of the things that you need to fight is the difficulty in initiating something for yourself, initiating something for others. Has become increasingly difficult. We've become somewhat immobile and maybe even fearful about reaching out to other people. But if you're feeling any of the things that we've been talking about, if you're feeling somewhat lonely or if you're feeling disconnected, the first thing you have to do is be mindful of the difficulty that you're having doing something to initiate, doing something to take care of yourself. If I had one wish, it would be to find something that you think you should do and turn it into something that you will do.
I think people feel like they're out of practice. Like I haven't done this in a while, and it used to be something you didn't have to think about. But I think along those same lines, almost everybody feels like that. And so, I've heard from people I see that the first time I saw some friends, even if it was outside, and we all sat across from each other, it was a little weird at first.
Yeah.
We're a little out of practice talking in real life. But once you get over that, it's not that all that different. The one last thing that we thought was pretty interesting was that there is an unprecedented number of cat and dog adoptions right now. I've actually had someone tell me it was hard to find a dog that they wanted to adopt, but the dogs and cats and getting a pet at this time can be such a great thing. Obviously, as long as it's okay with people's parents. So we just thought that was pretty cool.
So the question of when to consult with a provider, there's no clear answer to that. When issues become symptoms and symptoms become distress, it's probably time. It's probably time to find someone to work with that will provide you with opportunities for a new way of looking at things. The first time I think of something, I think, oh, that's an interesting thought. And the second time I think, oh, I've thought that before. And the third time I think, oh, case after case after case. But when you actually have the opportunity to work with somebody who's not inside your head, you have an opportunity to look at things in a new way. And I think that's a way of identifying possibilities and identifying the possibilities for change. There's one definition of psychotherapy that goes like this. Psychotherapy is a conversation between two people as to what one person really wants. And that's really not something you can do with a friend. A friend is not someone that will talk to you about what you really want without having to talk to them about what they really want also. And in therapy, I've asked this question, well, what do you really want? And then if you ask the next question, down deep, what do you want? And then if you ask the next question, in your heart of hearts, what do you want? Each of those questions results in a different meaning and a different answer and a different understanding. And hopefully when you're working with somebody that you trust in psychotherapy, you can get to the place of what's in your heart of hearts and be able to make the changes that make your life better. We're cheated by this pandemic. It's stealing time from us. And for those of us who are older, we don't really have the time to go along with the theft. So we have to get the time back. We have to find a way to be able to make our lives more like the lives that we want to be able to lead.
And how many psychologists does it take to screw in a light bulb?
Oh, I know the answer to that.
What's the answer?
One.
Just one, but the light bulb has to want to change. But I think for people that want to change or want to seek help, obviously we would encourage you to do so. And we have left a lot of resources at the end of this presentation to hopefully help people kind of navigate through that. I think the hardest thing for some people is trying to figure out where to go, where to start, when to seek care. And a lot of people that have never, ever done anything like this or had to do anything like this don't know what to expect. It is a little different than going to see your rheumatologist or your general practitioner. I think from my perspective, what I primarily do is the medication management piece, as Gloria alluded to earlier. And I think I want to hammer home the point that just because you meet with somebody for medicine doesn't mean you need to take medicine. It just opens up a conversation about what might be helpful. A lot of the times, if someone's in therapy, it's totally okay to ask your therapist what they think about medicine and if that would be helpful. And if they do, maybe they have some notions for you that you can kind of bring and talk about. Generally when someone comes to me that's never been to any mental health provider before, I do my best to make sure that, it's just a conversation about what's going on. I often will ask people, how can I help you the best? Someone much smarter than me once said, if I was a magic genie and I came to you in the middle of the night and I said, I can change one thing before the morning to make you better, make you feel better, what would that be? So I think, I challenge or invite everybody to kind of ask themselves that. And, that's the thing to bring to therapy. That's the thing to bring to the medication provider to see if we can pinpoint the help the best that we can. But I also always encourage people to remember that with therapy and with medicine, it's an ongoing conversation between us, between the mental health professionals and the patients. And so by that, you can kind of work together to find out what is going to help the best. So
And there are so many preconceived notions. Even before my son was a nurse practitioner, I grew up with psychiatry, and on either side of my office, I had psychiatry, and so I wasn't one of those psychologists that was ever anti-medication, although many providers tend to be that way. I think life is hard enough, and particularly during these times, when you're looking at the increase in anxiety and depression, I think another way of talking about that is you're seeing an increase in suffering. And I believe, because time is valuable, that you want to find a way to decrease suffering as much as you can. And if you take medicine and if you go to therapy, you don't have to sign up for a lifetime. Although that's good for our practices, it's really not essential. The goal of any provider in mental health is to actually put themselves out of business. And so I don't think Paul would say this, but there are side effects that sometimes occur with medicines, but there are also side effects that occur by not taking medicines. You may feel anxious, or you may feel depressed, and that might be the main symptom. But the side effects are difficulty in family relations, difficulty with losing the work interest, the productivity. Those are side effects. Those aren't the main effects. The main effect is you're feeling down and anxious. So it's worth thinking about that for psychotherapy too. People can be sometimes reluctant to find a counselor or a social worker or a psychologist because they're anxious about opening up something that that's novel, that they've never done before. But the people who you're working with, most of them have done this before, and the goal is to provide a warm and trusting relationship atmosphere where you can be in control with how much information you want to share and how much information you don't. So I would certainly encourage, particularly during this time, thinking about the the benefit that an outside provider could be to you or the family. I've had the opportunity to work with whole families in a large box or in small boxes together, and I'm pretty skeptical because I'm much more of an interpersonal kind of guy. But I've found that you can provide some pretty reasonably intimate care over the internet. And if you're feeling anxious and depressed, if it feels like life has really become burdensome, give it a try. You can always say no thanks after the end of a couple of sessions.
I think that's a great point. And I think that telehealth offers unique opportunities. I've gotten to meet people's cats and dogs. I've gotten to see people's artwork that always wanted to show me a painting that they made. And now, I had a patient the other day who said, I wish I could just show you this painting I just did. Since I've been feeling better, I started painting again. And I said, well, is it at your house? And she said, yeah. And I said, are you at your house? And she said, yeah. I said, why don't you show it to me? And she was able to do that, which was really pretty amazing. And it was actually a really good painting too. So, I think it does, as clinicians and patients, offer an interesting window into the lives of the patient and to an extent the provider. You can see I have a guitar on my wall, and people all the time will kind of bring that up, like, "Oh, you play guitar? That's pretty cool," and it opens a conversation that maybe wouldn't have happened with a patient. So hard to get used to.
I had a similar experience, Paul. I was working with a mom and her son, and the son was reluctant to get out of bed. And so I asked Mom if she would like to carry me into his bedroom, and we all got in bed together. Not literally, but we did. We did therapy for that session in his bedroom. And he never would have shown up for therapy if we didn't come to him. And so that was kind of fun. And it turns out that he had a good time.
So I was thinking we leave the last, we have some resources, like I said, in the end of the presentation that I'm hoping, I think the presentation will be available to people. I was hoping to take the last 15 minutes if there are questions. Gloria, are there any questions?
There are.
Okay.
You do hear me?
Yes.
Okay. One of the questions that I have is from an anonymous attendee, and she says, these statistics seem hopeless. Is there any help? Any hope? I'm sorry.
Paul and I wrestled with this very issue as we were presenting some of this data, and wondered if we were going to be the best bummer at the Jewish Federation. And we thought by at least presenting this, it increases the awareness that something can be done, that something probably should be done. There's so much that was going on before that was able to be swept up, but the virus has just increased the level of anxiety and tension. And that doesn't mean that we have to give up. In fact, it probably means that we have to do things to be able to work a little bit harder to make it work. My wife says, if you're not doing something to make it better, you're just being lazy. And why would you want to be lazy in the service of your own health and mental health? You probably want to be able to, and if you can't do it yourself because you're feeling down, connect with somebody who can help you do the thing. Connect with somebody in the family that's willing to be that support for you. Connect with a friend and share with them what you're feeling, so that you can move to the next place to make it better. I think knowing is always the first step of change, because I think, well, maybe the Rolling Stones said it. You can't get what you want until you know what you want. And so you got to know before you can get.
I think that's a good,
I'm sorry.
real quick, I was just gonna say that I think that's a good question, and something that I'm seeing all the time in practice. I said to a patient one time recently, what else can I do for you? And she said, well, if you could get rid of the coronavirus, that would be awesome. And I said, obviously, unfortunately I can't, but I would like to. So while I think those statistics are certainly daunting, I think they're also pointing to the fact that people are seeking more care. And there are professionals that are available to help people navigate through this, through medicine and through therapy. And so I think that the goal I hope people take away from this talk is that, not that the statistics are so bad, but that there actually are help available for these things. And we're here to help you navigate through it.
I think there's one last question that Christy Moretti is asking. When you see someone on overload / the brink of a breakdown because of all of the stressors of COVID-19 is placing on them, and you try to express concern, all they constantly say is, I'm fine, don't worry about me. Any tips to help them?
Are they coming for help? I mean, are they coming for therapy? Let's look at this in two different ways. If you can't get them, let's say it's an adolescent and you can't get them to come into therapy, have them come with you because as a parent, you need help. There are sometimes adolescents are willing to come and help their parents who clearly need help, and that they're willing to come with them or be seen as the family. People who might be reluctant to be the patient might not be reluctant if the family is the patient and the family is being seen together with a shared commitment to change. Uh, the the extreme of that is something that might be thought about as an intervention, where people who are involved with the person, who are loving and considerate of this person, come in a way that is at least mildly confrontational, that talks about the need for some kind of change to happen. And typically the people who say I'm fine and everybody knows they're not fine, those people are depressed, and we need to reach out further. We need to try a little bit harder to connect with them. I have I have people in my family who who are I'm fine, and we have very gentle discussions because they certainly don't want me to be the family psychologist. Sometimes I'll pass them off to Paul, but they certainly don't want me to be the family psychologist. It's easy to be frustrated and to walk away from these people because you see them suffer and you still can't seem to help them get to the next place. Don't walk away. You have to stick with it, because the first time you hear something, you may not necessarily want to do anything. The third time, the fourth time, maybe that's the time that'll actually work.
I think, especially from a medication perspective, and I said it before, but just to really make sure that the point comes across that just because you see somebody for medicine doesn't mean you have to take the medicine. Or if you take a medicine and you don't like it, that there's no reason to stay on it. There's so many different things to choose from. Which often I make sure I kind of hammer home, because I think a lot of people, that's the biggest thing. And I tell people, the first time I meet you, I'm just going to get some information. I'm going to tell you how I think I can help you the best, and then I'm going to ask you how you feel about that and what you think is the best way to help yourself. And hopefully those two things line up. And if they don't, then we'll have to find a way to come together and work together. I work together with patients. I don't work on my own. And so I think that's one tip to say, like, to that person, it seems like you could use a little extra help. Maybe let's just meet with him. And if you don't like it, if you don't like him, don't ever see him again. If you don't want to take the medicine, it's okay. But now at least we know what a professional thinks might help you. So I think that's important.
And Gloria, these days you can be invited into somebody's living room, and so that the person could be participating but not participating at the same time, and so you're there. I often make deals, particularly with kids who really don't want to participate. uh, 2 sessions, 2 hours. Don't you think 2 hours, you can afford 2 hours to help your mom or dad out? I mean, it's only 2 hours. That's not even a video game session for you, bud. So sometimes if you make a deal for 2 hours, and if I can't seduce you into sticking with me for because life can be better, then I guess that's it for now. But um, well, I don't like to give up so easily. I will continue, because these days, during the time of our pandemic, life has gotten harder, and I think it one could give up, but then you have two problems. You have life that's hard in the pandemic, and you've given up. So you have to be able to find some way of borrowing the energy, even if you don't have it, some way of connecting with people to help you to get to the next place, even if you can't seem to get there by yourself.
I think that's a good point about telehealth too. I saw a kid the other day, a little kid who for the first appointment, we met under his couch, and we found a Hot Wheels toy or car or whatever that he was looking for. So that was pretty sweet. And The next appointment, we met on the couch, but hiding under a blanket. And the third appointment, he was sitting at the kitchen table and his mom wasn't even there initially. I just wanted to say hi. So it kind of offers that kind of unique opportunity too, which I think is pretty exceptional. Any other questions?
Well, there is, I think, one last question from Christine Reddy. She said, I thought you'd play music for us, Paul, with your guitars from the wall behind you. I want to thank the Sheslows for really a super presentation. And there are questions, there are some more questions that we'll be able to answer offline. I also would like to.
Well, if you flip the last slide, I just wanted to show folks that these are general resources that can be really helpful. The National Alliance of Mental Health. Flip the next one, but messages for parents, school staff, online support for a variety of mental health and substance abuse issues, mindfulness resources, and us. So those resources will be posted on wherever they're posted.
I'm gonna tell you right now.
Okay.
Your presentation was terrific. And thank you, participants. Please come back and join us for our other wellness sessions. And feel free to contact us with feedback or to get further information or answers to the questions we could not get to today. On our landing page, you'll get the answers to the questions. And the landing page is siegeljcc.org/wellness. Coming up next, we have guided meditation with Kathleen Perkins from the JCC at 6 p.m. And I'm going to say, make pretend you hear a drum roll. You don't want to miss the Resilience in 2020 panel discussion moderated by JFS CEO Basha Silverman at 9 a.m. tomorrow morning. Thank you for your attendance.